In this video, I'm going to talk about why anxiety, depression are commonly associated with migraine, irritable bowel syndrome, chronic pain, and sleep disorder. These conditions frequently coexist because they share common neurobiological pathways, neurotransmitter imbalances, and stress-related dysregulation within the gut-brain immune axis. So, what is the shared pathophysiology? Gut brain axis dysfunction. The gut brain communicate bidirectionally through neural, um, like a vagus nerve, hormonal and immune pathways. In anxiety, depression, and IBS, there is altered gut microbiota, increased intestinal permeability, leaky gut inflammation, neurotransmitter imbalance. Gut barrier, gut bacteria produce neurotransmitters. Like 90% of serotonin is produced in your gut. 50-60% of GABA, quite a bit of dopamine, they are produced in gut. So there's an imbalance of that bacteria called dysbiosis that causes serotonin dysregulation, abnormal gut motility, and mood instability. Central sensitization in migraine, fibromyalgia, and chronic pain, the central nervous system becomes hyperexcitable. Overactive pain pathways and reduced inhibitory control that leads to the brain amplifying pain or discomfort signal. This mechanism overlaps with anxiety, depression, which also involves limbic system hyperreactivity and HPA, which is hypothalamic pituitary adrenal axis dysregulation. So, neurotransmitter imbalance. Serotonin is low in depression and anxiety, also regulates pain perception and gut motility. And so, the deficiency of which is linked with migraine and IBS. Norepinephrine affects arousal and pain modulation. Deficiency contributes to fatigue, low mood, and pain amplification. Dopamine, low dopamine tone affects reward pathways. So, anhedonia, decreased pain tolerance. GABA is an inhibitory neurotransmitter. So, its reduction causes both anxiety and increased neuronal excitability, causing migraine and insomnia. Chronic stress and HPA axis dysregulation. Chronic stress overstimulates cortisol release, causes immune dysregulation and inflammation that leads to migraine flare, IBS symptoms because of altered motility and visceral hypersensitivity, sleep disruption, depressive and anxious mood. Inflammatory cytokines, elevated cytokines like interleukin 6, tumor necrosis factor alpha, and C-reactive protein found in depression, IBS, and chronic pain syndrome. They promote neuroinflammation, a worsen neurotransmitter imbalance, and the vicious cycle of pain and mood disturbances continue. Treatment approach. A multimodal biopsychological approach works best, which addresses brain, body, and behavior together. Lifestyle and behavioral therapies, cognitive behavioral therapy, CBT improves coping mechanism, modifies catastrophic thinking, proven benefit for IBS, migraines, and chronic pain. Mindfulness and stress reduction, yoga, meditation. This reduces sympathetic tone and HPA axis activation, enhances serotonin and endorphin release. Sleep hygiene and chronotherapy helps you restore a sleep pattern to circadian rhythm, and that helps you balance serotonin, melatonin. Avoid blue light, caffeine, and late night stressors. Exercise. Aerobic activity increases brain-derived neurotropic factors. Serotonin, endorphins help reduce migraine frequency and anxiety and depression. So, migraine, what happens? So you have a migraine, IBS, chronic pain, depression, anxiety, and sleep disorder. So if people have migraine issue, they're treated with triptans like a sumatriptan and rizatriptan, those kind of medication. Beta blockers, propranolol, anti-epileptics like topiramate, antidepressant, amitriptyline, venlafaxine. IBS, we use low dose of tricyclic antidepressant like Elavil or amitriptyline, or low dose of also SSRI. They improve gut-brain signaling and motility. Chronic pain and fibromyalgia, we use duloxetine, which is SNRI, and GABA pentin kind of medication, low dose naltrexone. Depression and anxiety, we use SSRI, SNRI, and augmentation with a behavioral therapy, omega-3, magnesium, and vitamin D. Sleep disorder, underlying treating anxiety, pain, melatonin, trazodone, etc. Nutritional herbal adjuncts, magnesium reduces migraine frequency, muscle tension and anxiety. Omega-3 fatty acids, anti-inflammatory and mood stabilizing. Ashwagandha, rhodiola, the adaptogens that lower cortisol and improve resilience. Probiotics and prebiotics, they restore gut-brain balance and improve IBS and mood symptoms. Curcumin and berberine, they reduce neuroinflammation and oxidative stress. So, functional medicine food I want to talk about. So you need to definitely have assessment of gut microbiome health and probiotic repletion. Correct any micronutrient deficiency, B12, folic acid, vitamin D, zinc. Address hormonal imbalances like a thyroid, cortisol rhythm. Monitor inflammatory and metabolic markers like high sensitive CRP, fasting, insulin, etc. So the bottom line is that these conditions are different expression of same or common neurobiological and psychophysiologic imbalance. So treating the whole system, brain, gut, immune, stress axis, is the most effective long-term solution. This article, this video is about, it just inspired me because the last patient I saw on Friday, she was a 26-year-old female. She came with her dad, who was in mid-60s. And she's crying basically when I start talking to her. All of a sudden, she feels depressed, anxious. She hates her job. She had lost weight. And she doesn't know what's going on with her. And so when I was telling her, what could be wrong and how you're going to manage her, dad was more like, well, just give her some medication and try to take care of it. Why can't you give Prozac? Why can't you do this and that? And it's like, why can't you just scan her whole body? Why can't you do the MRI? Her feet is hurting, her knee is hurting, her shoulder is hurting. So why can't you do the scan? So I had a long talk with him. I said, look, we just can't scan her body and order tons of blood tests. We need to first of all, we need to do some basic tests for her, and then we need to really look deeper into what's going on with her. And I'm definitely going to have a psych evaluation, and I'm going to go over why such thing happened. And first of all, we have to make sure that her IBS, irritable bowel syndrome she had, is getting fixed with proper eating habits, and she needs to start sleeping on time. Those are the most basic fundamental things she has to start doing. So, then I heard the news about first test for Alzheimer's. So, I got 2 videos for you today, and those are all very interesting and informative. So, like them, share with your family, friends, and repost them. And thank you for watching. Great Monday.